Just 2 weeks on the job, and Virginia's new governor already is altering the state's approach to COVID-19. He's given parents the choice when it comes to masking their kids in schools, and now Governor Youngkin's requesting an extension on an upcoming vaccine mandate, specifically the one that applies to healthcare workers.
Kelly Grossfield was in Southwest Virginia and tells us why the governor is making this plea. Kelly?
Josh, Sarah, while the Supreme Court blocked OSHA's decision when it came to mandating vaccines, that wasn't the case when it came to the Centers for Medicaid and Medicare Services vaccine rule. This rule will take effect on February 14th and would cover 10.4 million healthcare workers at over 75,000 medical facilities. But for hospitals in more rural areas like Southwest Virginia, this poses a problem as they continue to battle staffing shortages.
Our healthcare heroes have been absolutely going around the clock for 2 years now, and we're seeing real stress in the system.
Governor Youngkin saw the stress on hospital staff firsthand, and he feels the CMS vaccine ruling would just make that worse. It's something the governor and Ballad CEO Alan Levine agree on.
Let's be logical and reasonable with the regulatory structure here. Why do you want to create a worse staffing problem than we have? One has been inflicted by COVID. The other is potentially going to be self-inflicted, and it's just I think, a big mistake.
It's for that reason Governor Youngkin, alongside West Virginia Governor Jim Justice, penned a letter to CMS officials requesting a limited waiver, citing that the staffing crisis should mean relief from the rule.
We've asked for an extension or the ability to, in fact, see our way all the way through to the summer, so we can get through this period of time.
The current rule would mean workers in healthcare settings must have the first shot by the 14th of this month. But Levine, from a healthcare perspective, says it's an impossible choice.
Comply with this one and hurt people potentially, or comply with this one and be out of compliance over here. That's just not the way you regulate.
Virginia health officials would not weigh in on the letter specifically, but did cite the enhanced danger for the specific group if they aren't vaccinated.
If you're in a healthcare setting, you're going to be more at risk of COVID, along with, other things that you're exposed to. But absolutely, those folks are the most at risk of COVID and ill effects from it, which is why they were the first people to, be offered the vaccine.
But what happens if the CMS denies this request? Youngkin said he will never allow a vaccine mandate and will always take the stance of it being a choice.
We're looking at every avenue possible in order to make sure that our hospitals can stay fully staffed.
Youngkin said if the CMS does not grant an extension, Virginia's Attorney General Jason Miyares is looking to join a lawsuit out of Louisiana against that same CMS ruling.